If your house's foundation is sinking, you don't just, grab some spackle, smooth over the cracks in the drywall, and throw a fresh coat of paint on it.
Right, because that might look good for, like, a week, but you're completely masking a structural crisis.
Exactly. When the whole house eventually shifts, that cosmetic fix isn't going to save you. But when it comes to the human body's ultimate structural foundation, which is the pelvic floor, millions of women are being sold the exact equivalent of a cosmetic spackle job.
Yeah, we're seeing this massive industry built around addressing the surface while just completely ignoring the underlying architecture. And, I mean, the consequences of that can be severe.
So welcome to today's deep dive. Our mission today is to cut straight through the slick marketing buzzwords, specifically looking at things marketed as vaginal rejuvenation and tightening.
Which is a huge topic right now.
It totally is. And we've got a massive stack of sources here. On one side, we have promotional materials from high-end cosmetic gynecology clinics pushing devices like Empower RF, Femilift, and Thermiva.
And then on the other side, we have stringent clinical guidelines from the UK's National Health Service, the FDA, and major gynecological colleges.
Right. So we're trying to answer one critical question based on all this data. And that is, when do you actually need to see a pelvic floor specialist before you even consider letting a clinic perform a tightening procedure?
And to answer that, we really have to look at the massive gap between what people feel and what is actually happening medically.
Okay, let's unpack this. The sources note something really wild. About 8.4% of women in the UK report feeling a physical vaginal bulge.
Yeah, but when those same women are given a clinical examination, up to 50% of them are actually diagnosed with pelvic organ prolapse.
Wait, really? So half the time someone thinks they just have like a minor symptom, but their organs are literally shifting downward.
Exactly, because the floor holding them up has given way. What's fascinating here is how the language we use, like rejuvenation or laxity, often masks serious medically definable conditions.
Because the pelvic floor is, well, it's a complex bowl of muscles and ligaments.
Right. And when clinics market a solution for looseness, they're using aesthetic terms to describe the aftermath of childbirth or the drop in estrogen during menopause or just natural aging.
They're taking functional medical conditions like stress urinary incontinence, where you leak urine when you laugh or sneeze, and framing them as, issues that just need a quick cosmetic fix.
Which is incredibly misleading.
So let's look impartially at what these cosmetic clinics are actually selling. Because you go online, you search for these symptoms, and the ads are just everywhere.
Oh, they absolutely dominate the search results.
Yeah, and they're heavily promoting energy-based devices or EBDs. These involve either CO2 lasers or radiofrequency wands. And I have to say, the pitch is incredibly appealing.
It is. They promise a 15 to 30-minute outpatient visit.
Right. You go in on your lunch break, you experience zero downtime, and you just go back to work. But how does that even work?
Well, the clinical mechanics behind that pitch are based on thermal injury. These devices are designed to gently heat the internal vaginal tissue to about 40 to 42 degrees Celsius.
And the marketing materials claim this targeted heat stimulates collagen production, which will tighten the canal, restore moisture, stop those urinary leaks. But, I mean, what is actually happening to the cells when you heat them to 42 degrees?
Basically, you are creating a controlled microburn.
Oh, wow. A burn.
Yeah, exactly. When the body senses that thermal injury, its natural defense mechanism kicks in. It rushes blood to the area to heal the tissue.
Which is vascularization, right?
Spot on. Your body builds new, tiny blood vessels to supply oxygen and nutrients to the damaged area. And this rush of blood brings temporary moisture and plumps up the surface tissue with new collagen.
Okay, let me try an analogy based on the anatomy I'm seeing in these medical diagrams here. If the pelvic floor is essentially a muscular hammock that supports your bladder, your uterus, and your rectum, are these quick-fix lasers actually fixing the thick ropes of the hammock, or are they just shrinking the fabric on top?
They are entirely focused on the fabric. The vagina is not just a surface layer of skin. It's a suspended muscular cube.
So the laxity isn't a skin issue.
Almost never. It's a structural weakness in the heavy ropes, specifically the levator ani muscles and the deep ligaments of the pelvis.
So heating the surface to 42 degrees.
It might temporarily swell and shrink the surface tissue, sure, but it does absolutely nothing to repair a torn muscle or a failing ligament deep inside the body.
Which perfectly explains why the American College of Obstetricians and Gynecologists explicitly states that vaginal rejuvenation is just a marketing term. Like, it doesn't even exist in medical diagnostics.
Exactly. Though, to be completely fair to the data, Those energy-based devices do show some short-term promise for one very specific surface issue.
The menopause symptoms, right?
Yeah. During menopause, the drop in estrogen can cause severe dryness and thinning of the vaginal walls. The clinical term is genitourinary syndrome of menopause.
And because the laser triggers that rush of blood, it actually helps with moisture?
Right, it can help restore moisture for those patients, but treating a structural sag or urinary incontinence with a surface laser is a totally different proposition.
And this is where we really have to look at the official safety warnings. Because if you're treating the fabric instead of the ropes, things can go wrong.
Very wrong.
The FDA issued a massive safety communication in July 2018 about these exact devices. They firmly stated they have not cleared or approved any energy-based devices for vaginal rejuvenation or for treating urinary incontinence.
And those warnings from the FDA, along with the Royal Australian and New Zealand College of Obstetricians and Gynecologists, they focus on severe adverse events.
Yeah, because while the clinics report high patient satisfaction and, minimal downtime, the official medical bodies are documenting cases of vaginal bonds, severe scarring, and chronic pain.
This raises an important question, though. How do we safely treat these distressing symptoms if quick-fix lasers carry such warnings?
Well, I was reading the interventional procedure overview from the UK health guidelines, and the case studies are, honestly, they're sobering. They document patients who went in for this laser therapy and developed crescent-shaped fibrous bands and vaginal strictures.
Yeah, those strictures are a serious complication.
But how does a laser, meant to just boost collagen, end up causing a stricture that completely obstructs the canal?
It comes back to that microburn we discussed.
Right.
When you heat tissue, even carefully, you are damaging it.
Just like a burn anywhere else on the body.
Right. And just like a severe burn on your arm, the body sometimes overcorrects during the healing process by creating dense, rigid scar tissue.
Oh, I see.
And inside a muscular canal, that scar tissue doesn't just sit flat. It can form thick, tight bands that pull the tissue together.
So a stricture means the canal is literally fusing and narrowing.
Exactly. Which can create a partial or complete obstruction that makes basic functions or intercourse agonizingly painful.
So if the FDA is saying these lasers are essentially risking severe scar tissue without fixing the structural sag of the hammock, what does the medical community actually recommend we do with a failing foundation?
Well, they mandate a completely different starting point, which is universally known in the guidelines as the physio-first approach.
Okay, what does that actually mean for someone listening?
The American Urogynecologic Society reviewed all the data and found a striking lack of what we call level 1 evidence, which is the absolute highest quality of clinical proof that lasers can safely fix structural issues like prolapse or incontinence.
So you don't start at a medical spa.
No, you start with a pelvic floor physical therapist or a urogynecologist.
The latest NICE's guidelines from the UK NG 123, I think they lay this out very strictly. If a woman has a symptomatic stage 1 or stage 2 pelvic organ prolapse, the very first intervention isn't a laser and it isn't surgery.
It is a program of supervised pelvic floor muscle training for a minimum of 16 weeks.
Wait, hold on. If a listener is leaking urine when they sneeze and feels quote-unquote loose, why should they spend 4 straight months doing exercises when a clinic offers a 20-minute laser treatment today?
Because building actual muscle tissue takes time. I mean, you cannot microwave a muscle into being stronger.
That's a great way to put it.
When you do resistance training, whether it's your bicep or your pelvic floor, you are creating microscopic tears in the muscle fibers. Your body then repairs those fibers, making them thicker and stronger.
And that biological process of creating new structural tissue just inherently takes about 3 to 4 months.
Right. A 20-minute laser procedure is creating surface swelling, not muscle fiber.
So what does that 16 weeks actually look like? Because I assume it's not just someone handing you a pamphlet on Kegels and telling you to squeeze.
Oh, definitely not. A generic internet article telling you to do Kegels is often useless and sometimes even harmful.
So what does the specialist do?
A specialist performs a highly specialized digital examination, meaning they use their fingers vaginally or rectally to physically assess the muscles. They grade your baseline strength using the Oxford scale.
How does that scale work in practice? I saw it mentioned in the sources.
It goes from 0 to 5. A 0 means there's absolutely no muscle contraction at all. The muscle isn't firing.
Okay, and a 5?
A 5 is a strong, sustained squeeze and lift that pulls upward into the pelvis. They also check for asymmetry during this.
Asymmetry, like one side is stronger than the other.
Exactly. Maybe the left side of your muscular hammock is a solid 4, but the right side suffered nerve damage during childbirth and is a 1. You cannot diagnose that asymmetry without a physical exam.
That makes total sense. The sources also detail something they teach called the knack, which sounds honestly like a secret superpower for your pelvis. What is the mechanics behind that?
The knack is a brilliant piece of biomechanics. Imagine your abdomen is a balloon. When you cough, sneeze, or lift a heavy box, you squeeze the top of that balloon.
And the pressure has to go somewhere.
Right, it pushes forcefully downward onto the pelvic floor. If the floor isn't ready, you leak urine or exacerbate a prolapse.
So the knack is a way to stop that.
Yes, it's a precisely timed technique where you intentionally contract and lift the pelvic floor muscles right before that downward pressure hits. You are actively bracing the bottom of the balloon against the cough.
Oh, so you're creating a biomechanical counterforce.
Exactly. And you cannot learn that timing from a laser wand. It requires a physical therapist using biofeedback, sometimes placing sensors on the muscles, to show you in real time if you are actually bracing correctly.
And the data on putting in that 16 weeks of work is wild. Up to 55% of patients can achieve a clinical cure for their symptoms with intensive supervised exercises maintained over 6 months.
Over half of the people facing these structural issues can essentially reverse their symptoms just by retraining their own biology.
It's a phenomenal success rate for an intervention that carries zero risk of burns or strictures.
Which completely reinforces why assessing the physical structure is the mandatory first step.
But here's where it gets really interesting. I noticed something strange in the urology news and NHS data. Bypassing a specialist could be dangerous for an entirely different reason.
Yes, the paradox of a hypertonic pelvic floor. It is a critical misconception.
Hypertonic just means a muscle has too much tone, right? Like it's far too tight. Because the sources describe how a lot of women try to self-manage their incontinence. They're terrified of leaking in public, so their natural defense mechanism is to just hold their pelvic floor muscles tight all day long. They're constantly clenching.
Think about holding your shoulders up by your ears in a state of constant stress.
Oh.
Right. If you do that for months, those shoulder muscles become stiff, shortened, and incredibly painful. They lose their dynamic ability to stretch and contract.
And the exact same thing happens in the pelvis.
Totally. The muscles become completely exhausted from being clenched 24/7. Because they are exhausted, they fail to react when you sneeze, so you leak urine.
So the person feels a leak, they feel a dragging sensation, and they logically assume, my muscles must be too loose.
Which leads to a disastrous decision.
Because if that person skips the physical therapist and walks into a cosmetic clinic asking for vaginal tightening, what happens?
It's throwing gasoline on a fire.
Literally the worst thing you could do.
Yeah, if you take a structural foundation that is already pulled incredibly taut and exhausted, and you apply a laser designed to induce further tightening and scarring, you are going to exacerbate their symptoms exponentially.
The clinic is treating the assumed looseness, but they're actually attacking an overworked muscle.
Right. And this presents clinically as conditions like vaginismus, where the muscles spasm involuntarily, or dyspareunia, which is severe pain during intercourse.
Because the muscles are just locked up.
Exactly. When a specialist does an exam on a hypertonic patient, they often find that these shortened, stiff muscles are creating a physical muscular hurdle inside the pelvic canal.
So the treatment protocol for that has to be the exact opposite of a laser tightening.
The treatment is relaxation therapy.
Like massage.
Very similar. The therapist uses manual release techniques, much like a deep tissue massage for a knotted shoulder, but applied to the pelvic muscles. They teach diaphragmatic breathing.
Oh, biofeedback again.
Yeah, to teach the patient how to actively relax the specific opening in the pelvic floor where the urinary and reproductive tracts pass through.
Dropping the urogenital hiatus, right?
That's the medical term. In plain English, they have to teach you how to unclench the trapdoor.
This brings us all the way back to the core focus of today's deep dive. When do you need a referral to a pelvic floor specialist before you consider vaginal tightening?
The answer is in every single scenario.
You absolutely have to see a specialist first because your own physical sensations are deceptive.
They really are. What feels like looseness could be a severe structural prolapse where your organs are descending, requiring 4 months of targeted muscle hypertrophy.
Or it could be the complete opposite, an overactive, exhausted muscle group that is screaming for relaxation therapy, not a laser burn.
A sensation of heaviness or leakage is just a distress signal from the body. It tells you there is a problem with the foundation, but it does not tell you the mechanism of the failure.
Only a functional structural assessment by a trained specialist can map that out. We've covered incredibly important ground here today. We've looked at the very slick marketing of the cosmetic gynecology industry and that seductive promise of a 20-minute fix.
And we've unpacked the FDA's severe safety warnings about how thermal microburns can cause fibrous strictures.
We've explored the biology of the Physio First mandate, learning why it takes 16 weeks to rebuild the ropes of the hammock. And we've seen the very real danger of applying a tightening laser to a hypertonic muscle that desperately needs to relax.
Because understanding the underlying biomechanics really empowers you to make medical decisions based on actual biology, rather than just reacting to a billboard promising rejuvenation.
So for you listening, if you're experiencing these symptoms, if you feel a bulge, if you leak when you laugh with your friends, this isn't just something you have to quietly endure as a normal part of aging.
It's really not.
And it doesn't mean you need to immediately jump to spending thousands of dollars on an unproven cosmetic device.
Yeah.
True healing starts with a structural engineer, a pelvic floor specialist, assessing your unique anatomy.
The foundation can almost always be strengthened or rehabilitated once you know exactly what is causing the cracks.
I want to leave you with one final thought from the sources that perfectly captures the scale of what we are dealing with. I was looking through an International Continence Society consensus report.
Oh, that's a massive document.
It is. They gathered the world's leading experts to standardize the terminology around pelvic floor dysfunction. Do you know how many separate definitions they established for the conditions, signs, and symptoms in this one area?
It is a staggering number.
250. 250 distinct medical definitions to describe what can go wrong in the pelvic floor. So I leave you to ponder this. If the global medical community requires 250 different definitions to understand the nuanced structural mechanics of the human pelvis, how could a one-size-fits-all cosmetic laser procedure ever be the ultimate answer? Fixing the foundation is complex and it takes time, but the results of actually doing the work are incredibly profound.